contrary to what you read about, that the healthcare system's so wonderful here, it's all right. It's just that it's different, and I think that's the part you got to navigate.
I talked with several expats in Costa Rica about healthcare, insurance, and pharmacies. Here are their personal experiences, including costs.
We have health insurance, actually. We do, there's cheaper plans for expats that are outside the country for 330 days, and they cover major medical. You can go back to your home country and get work done if you want to. They even cover you in your home country when you visit, as long as you're out a certain amount of days. But then we deal with your kind of daily accidents. I have kids, things happen. In the community here, there's been broken arms and surprise surgeries and things like that. Most of that people all choose to do within Costa Rica.
Costa Rica has a strong public health system.
In fact, it's ranked higher than that of the U.S. Costa Rica's healthcare system is one of the best in Latin America. With world-class facilities like CIMA in San Jose, affiliated with Baylor Medical Center, and Clinica Biblica, also in San Jose, you can receive a level of care and expertise equivalent to modern U.S. facilities. Dental care and dental tourism has become prominent in the last few years, providing dental services at a fraction of the cost found in the States. Residents have two options: the public healthcare system alone, or the public system combined with private insurance.
For example, I have an insurance policy that will cover visits to private medical facilities, and I feel like I've got access to great medical attention, and it's a lot less than it would be if I were in the United States.
Private plans cost around $50 to $100 a month and offer access to a selection of modern hospitals and clinics. A network of 28 hospitals throughout Costa Rica provides modern and reliable medical emergency service. Doctors at these hospitals usually receive their initial training in Costa Rica and obtain more advanced training in their specialty in other countries, mostly the U.S.
Well, there is a clinic about 8 kilometers from here which can handle most problems. There are, as of the last couple of years, there's several private doctors here. One of them is an American trained guy. He's actually a good person. He can take care of most simple things. If you need to get helicoptered out, that's an option too here. So actually the medical situation has improved here dramatically in the last couple of years, and actually a lot of foreigners come here to take advantage of the, well, there's a good basic health care, and it's not that expensive.
There are also more than 245 small clinics scattered throughout Costa Rica that provide varying levels of health care even in these remote areas. Pharmacies are commonly used in place of a doctor's visit for minor illnesses. Pharmacists are well educated and able to diagnose and treat common illnesses and permitted to distribute medications as well. Most medicines are available without prescriptions. Only narcotics and addictive drugs require a prescription. All pharmacies are required to have a pharmacist on the premises in order to be open for business.
Back home, one of the big things is you listen to your doctor tells you something. You say, okay, fine, I'll do it. Here you really need to question everything. You need to question it because the technique they may be using may be antiquated, and it makes you a better patient because you start learning how to do that and being part of the process. But let's say they were going to do open heart surgery on you here, I would say definitely go somewhere else. The healthcare here is very affordable. That's a great benefit. That part is true. You can go, like I went to the ER with my daughter not too long ago, and we were there for a night, and they had to call in a blood person, they had to call in an x-ray technician, they had to call in a surgeon, and so you have all these people. In the US, my mind was like, oh God, this is gonna cost like thousands of dollars, and then we went and paid, and it was $700. So that same thing in the States is, we also went to the ER in the States. We went to just a short procedure, and in the States it was $18,000, and this in Costa Rica, which was longer with more professionals involved, was $700. So you definitely, it's a better value here for sure.
More information about Costa Rica can be found in our video, 8 Great Places to Live in Costa Rica, available on Amazon. Or visit our website at www.livingoverseas.tv. If you enjoyed this video, please give us a like and subscribe. It will help us to keep making free videos like this.